there was going to be a lot of work. And the reason I knew there was going to be a lot of work when I started here at Denver Harbor was because, especially in underserved communities, there's many barriers that the patients face. But it's gratifying work, and that's also what I expected, because the best thing about being in an underserved community and treating people that do need care is that they're appreciative for the care that they receive.
The partnership with Methodist Hospital and Denver Harbor Clinic allows us to see a lot of patients. They're all in different walks of life. It's a real life situation.
This collaboration with the Family Medicine Residency Program generates new providers. I can't tell you how many of these residents, had they not, are going into community type care settings because of the experience that they've had here.
Once we have the opportunity to see the value of the physicians in the community areas, it moves us into trying to follow that example.
Many of our patients are uninsured. They either get care here or they don't get care at all. So from an educational side, it provides a lot of experience for our residents because, these are patients who are not running off to the dermatologist to have their moles looked at. They're not running off to the cardiologist to manage their blood pressure. They get their care here or they don't get it at all.
The patient is really being seen by two physicians in one visit. First, the resident physician. We develop a plan. We then discuss this plan with a mature faculty attending physician, and we talk about what other things could be done for the patient.
The quality of care they get here is absolutely amazing. It's great, and it definitely would be a great investment in providing quality care for folks who can't afford it. And so it's helping the community.
Having the residency program here at the Denver Harbor Clinic provides sustainable health care for this community. Year after year, new residents are recruited to the program. As long as we're here, there will always be primary care physicians in this community.
We know that areas that have more primary care physicians have better medical outcomes at lower costs.
I have a wonderful family now that I'm going to be taking care of 3 generations. And I've only been here 2 years, but I am going to take care of 3 generations within the family. And it's been a joy seeing them all and following them within these past 2 years.
I see many patients and they remind me of the families that I grew up with. And I also do believe that I will be working in an underserved community once I do graduate, and that's my hope and my goal.
Medicine is of service, and providing a service in areas where people need it the most is very valuable.